Topic 10. Increased intraperitoneal volume, IIPV. What is increased intraperitoneal volume, or IIPV? IIPV is a situation when the total intraperitoneal volume, IPV, of fluid exceeds the intended target volume at a specific point in the PD cycle based on the patient's prescription. IIPV is an inherent risk in peritoneal dialysis and is not specific to the home choice APD system. IIPV may be caused by an increase in the fill volume, ultrafiltration volume, or residual volume due to inadequate drainage of dialysis solution from the peritoneal cavity. Although the term overfill may be used interchangeably with the term IIPV, overfill may be associated with a patient's feeling of abdominal fullness due to eating a large meal, constipation, or abdominal masses without an actual increase in the intraperitoneal volume. What are the symptoms of IIPV? While some people may not exhibit symptoms, the most commonly observed symptoms of IIPV include feeling full, bloated, or overfull, abdominal pain or discomfort, expanded or tense abdomen, vomiting or spitting up, difficulties feeding, localized swelling around the PD catheter exit site, belly button, groin region, or genital area, leaking of fluid from the PD catheter exit site, difficulty breathing, a child complaining of a funny feeling in the abdomen, a child crying, unexpected increase in blood pressure. What should the patient do if they suspect IIPV? If you suspect your patient has IIPV, please tell your patient or the patient caregiver to do the following. Press stop immediately. Then press the down arrow and initiate a manual drain. The manual drain procedure is located in the Patient at Home Guide. Call the dialysis center. If the patient cannot reach their dialysis center and is experiencing symptoms of IIPV, they should call 911 immediately or go to the nearest emergency department. If you need further assistance, call the Baxter Global Technical Services Group, available 24 hours a day, 7 days a week, at 1-800-553-6898. Does the system provide any indication of an IIPV situation? Call PD nurse, alternating with high drain XYZ is a new message that will appear at the end of the therapy or the beginning of the following therapy if any drain phase in the previously completed therapy drained a large percentage of the programmed fill volume. In standard fill mode, it appears if 200% or more of the fill volume was drained, and in low fill mode, if 190% or more of the fill volume was drained. The number that appears after high drain indicates when it occurred. If your patient experiences a call PD nurse high drain XYZ alarm, it's important to review your patient's therapy program and discuss any drain bypasses that your patient may have initiated to reduce the risk of future instances of IIPV. What programmable factors influence the risk of IIPV? The programmable settings on the Home Choice and Home Choice Pro APD systems control how much fluid is delivered and removed from the patient. Since the system keeps an estimate of the amount of fluid in the patient's peritoneal cavity at any given time in the therapy, improper programming of these settings may have adverse effects leading to the excess volume filled or insufficient volume drained from the patient. The programmable settings that can impact IIPV generally fall within two categories. 1. Settings that determine fill volume, including fill volume, day fill volume, night fill volume, last fill volume. And 2. Settings related to drain volume, including iDrain alarm, minimum drain volume, last manual drain, UF target, total UF, tidal full drains every, iDrain time, minimum drain time, and negative UF limit. To prevent an IIPV situation, you must take care to program the fill volumes and the drain volume settings properly.